Is sex safe during pregnancy? Pregnant women and their husbands often wonder if it is safe to have sex during pregnancy. Most of the time, people do not know whom to ask this question and are even hesitant in asking their doctors about this. They have concerns such as, will it cause a miscarriage? Will it harm the unborn baby? Does the baby know what's happening and how to do it safely? Welcome back to another episode of Omegy. In this video, we will talk about whether it is safe to have sex during pregnancy. So here is what to know. Is sex safe during pregnancy? Yes, it is. Sex is a natural and normal part of a couple's life during pregnancy. Penetration and the intercourse movement do not harm the baby. The baby is well protected and cushioned by the amniotic sac, the mucus plug at the mouth of the uterus, the muscular uterus walls, and finally, your abdominal walls. Can sex trigger labor? Not really. The contractions of the orgasm aren't the same as the labor contractions. These are transient tightenings of the uterine muscle known as Braxton Hicks contractions, and they usually quickly pass off on their own. Still, as a general safety precaution, your doctor might advise you against having sex in the final weeks of pregnancy, as the hormones in the semen can sometimes stimulate contractions. These hormones work in a similar way to the hormones known as prostaglandins. For the same reason, having sex in postdated or overdue pregnancies sometimes can help to induce labor. The sex drive during pregnancy varies for every woman. Each woman's experiences during pregnancy are different, including how they feel about sex. Some women may experience a fade in desire during pregnancy, while others may feel more deeply connected to their sexuality and become more aroused when they are pregnant. Some women feel that their desire increases because they no longer have to worry about birth control. So, during pregnancy, it's normal for sexual desire to fluctuate as your body changes. You may feel overly conscious as your belly grows, while some women may feel sexier with their larger or fuller bodies. In the first trimester, due to symptoms like nausea, fatigue, or breast tenderness, it's common for your sex drive to decrease. However, do not worry, as it will come back. In the second trimester, as women generally become more comfortable, the sex drive might return. However, in the third trimester, sex may feel uncomfortable in the last few weeks of pregnancy due to body size, anxiety, and worries about childbirth and potential harm to the baby. When it comes to sexual positions during pregnancy, lying flat on the back in the normal missionary position or having sex after the 4th month of pregnancy may not be safe or comfortable. With the baby's bump in between, it becomes difficult and potentially unsafe. Additionally, this position can constrict the major blood vessels at the back that supply blood to the baby and uterus. It is advised to avoid lying flat on your back after the 4th month of pregnancy. Any position that reduces pressure on your belly is considered safe. This can include the woman being on top or the side or in any position where there is no direct pressure on the belly. In case of vaginal dryness, you can use a lubricant to make sex more comfortable. However, if sex continues to be uncomfortable, you can still enjoy intimacy in other ways, such as engaging in oral or anal sex. However, it is crucial to exercise caution. It is unsafe and dangerous for the partner to blow air into the pregnant woman's vagina. Remember, this act can be life-threatening as it can cause an air embolism, which can be immediately fatal. On the other hand, engaging in anal sex will not harm the baby, but it may be uncomfortable if a woman has pregnancy-related hemorrhoids. Should you use barrier contraception or condoms? As always, if you are not sure about your partner's sexual history, you must use a condom. Remember, pregnancy does not protect you against sexually transmitted infections such as HIV, herpes, genital warts, and chlamydia. These infections can also affect your baby. So, please make your decision wisely, as it is very important to prioritize your health and the health of your baby. When should you avoid having sex during pregnancy? There are several situations to consider. Number 1 is if you are at risk of miscarriage or have a history of past miscarriages in previous pregnancies. Number 2, if you are at risk of premature labor, which means having contractions before the baby has matured, before 37 weeks of pregnancy. Additionally, you should avoid sex if you are experiencing any kind of vaginal bleeding or infective vaginal discharge, if your amniotic sac is leaking fluid, or if you have ruptured membranes. If your cervix has opened too early and your doctor has advised bed rest, or if you already have a cervical stitch in place, which is a stitch placed at the mouth of the uterus to prevent the premature opening of the cervix, you should abstain from sex. Another reason to avoid sex is if your ultrasound shows placenta previa, which means the placenta is not lying in the proper position. Lastly, if you are expecting twins, triplets, or multiple pregnancies, it is advisable to refrain from sexual activity. After pregnancy sex, it is important to be aware of red flag signs. If any of these signs occur, it is crucial to immediately inform your doctor and report to the emergency room. Number 1. If you experience any kind of pain in the lower abdomen or contractions in the uterus that are not subsiding, these contractions refer to transient tightening that are not improving. Secondly, if you notice any vaginal bleeding or a watery discharge from the vagina, or if you experience any significant discomfort, these signs should be taken seriously and prompt medical attention should be sought. What if I don't want to have sex during pregnancy? That's perfectly all right. There is more to intimacy than just sex. It's important to discuss with your partner openly and lovingly if sex is difficult, unappealing, or off limits for you. Remember, it's okay to choose not to engage in sexual activity during pregnancy if it doesn't feel comfortable or desirable to you. What are the benefits of sex during pregnancy? Sex during pregnancy can have certain benefits. Number 1, it keeps you fit as it burns calories and helps to keep both partners physically active. Moreover, it improves the bonding between partners. Some couples find that engaging in sexual activity during pregnancy brings them closer together. Additionally, a study conducted in 2004 found that sex during pregnancy can give a boost to the immune system by increasing the levels of IgA, which can help fight against infections. Furthermore, engaging in sexual activity during pregnancy can cause increased happiness. This is because sex releases endorphins, which can make both the mother and the baby feel happy and relaxed. How about sex after delivery? In the first 6 weeks after delivery, known as the postpartum period, sex may be the last thing on your mind. You may have little desire for it due to various reasons. Firstly, you may have stitches down below from an episiotomy, which is an incision made during vaginal delivery. Additionally, you may be healing from abdominal incisions if you had a C-section. It is common for women to experience bleeding for about 6 weeks after delivery, which also contributes to discomfort during sex. Fatigue is another factor that affects postpartum sexual desire. After giving birth, you are understandably tired from the whole process and the demands of caring for your newborn. The change in hormone levels, specifically a significant decrease in estrogen and progesterone, can also impact your body and sexual drive. Sore breasts from breastfeeding may further contribute to discomfort. Moreover, many women experience postpartum blues, anxieties related to parenting, and relationship issues, which can also affect their readiness for sexual activity. As doctors, we always advise waiting for at least 6 weeks after delivery before engaging in any kind of intercourse. It is crucial to be emotionally ready, physically comfortable, and relaxed for a positive sexual experience. And that wraps up the video. Do you have any questions or reactions? Don't hesitate to comment down below. Leave a like and subscribe so you won't miss out on our videos. Thank you for watching. This is Amaji, and we will see you in the next video.